Talking health with us this morning is Dr. Scot Ackerman from the Ackerman Cancer Center. Joining us to break this down, certainly so many people across the country and the world are mourning the death of somebody who was truly a trendsetter.
Yes. Good morning, Vic. It's very sad. Colin Powell's story he was a great man, but multiple myeloma is a difficult disease, and it causes all sorts of complications. And when you have a disease like multiple myeloma and COVID, it causes more of a problem. Diseases like multiple myeloma make you more susceptible to COVID, and these are the kind of patients that have bad outcomes if they were to get COVID.
Yeah, certainly. So we are bridging that gap. Obviously, we don't know all of his medical history. We only know the details that his family was able to share with the public. But I do want to ask you about that, because they pointed out that he was fully vaccinated. But then we have learned from doctors that being fully vaccinated while you are battling a severe illness like cancer could make your immunity lower than a typical person who has their full vaccine, right?
Correct. So if you have cancer, or if you're getting cancer treatment, your immunity goes down a little bit. So even if you're vaccinated, which gives you lots of protection against COVID-19 or protection against other diseases as well, that you're vaccinated for, even if you're vaccinated, the fact that your immunity is down puts you still a little bit more susceptible. And with myeloma, it's a disease of the bone marrow. So even more so does it adversely affect your immune system.
Let's talk a little bit more about multiple myeloma. My grandfather battled it. It is a difficult cancer. Who is at risk for this type of cancer?
So there are some risk factors associated with multiple myeloma. Number one is age. People over the age of 65 are at higher risk than those people that are younger. Men, it's more common in men than women. Also race. If you're African American or Black, you have probably 2 times the risk of developing multiple myeloma than Caucasians. And also people with other plasma diseases, disorders, something we call MUGUS, or monoclonal gammopathy of undetermined significance. These people are more likely to develop into myeloma. Or even people with a tumor called a solitary plasmacytoma. That's a disease or one tumor in the bone, and that could also frequently lead to multiple myeloma.
Yeah, obviously, I know that your team has some great treatments to hopefully help people here. What do you do for screening, and when does somebody need to raise that red flag and go see a doctor?
Yeah, so there's no good screening for myeloma. We have screening for colon cancer and breast cancer and prostate cancer, but we don't typically screen for myeloma. Patients present with certain symptoms, and it's important that patients and physicians are in tune with those symptoms and don't forget to look for things like myeloma. So symptoms like a low blood count or infections or fatigue could lead to blood tests that would show that the blood count's low, and that would then lead to doing additional tests such as a bone marrow biopsy or something called a serum protein electrophoresis. It's a big term, but we're actually looking at the cells themselves to help diagnose myeloma. But there's no good screening. It's just being aware that the disease exists and making sure you see your physician and having the appropriate tests.
Early detection, early intervention. Dr. Scot Ackerman, thank you for your time this morning.
Thank you, Vic.